get started.
All right. Well, welcome to the AHEAD Primary Care Program application process. And we're really lucky today because we have as our principal presenter Andrea Mullins, who is going to be kind of answering questions for us and everything. And I'm Gene Ransom. I'm the CEO of MedChi. I'm going to be asking the questions. So that's kind of the game plan for today. And the one thing I really would like to say at the beginning is we don't care if you're a member of MedChi or not. We don't care if you're using our CT or not. If you need help with this, just please reach out, set up a one-on-one meeting with somebody on our team, whether that's Cassandra or Daphne or Andrea herself. We're happy to help you through it. We want doctors to take advantage of this program. So why don't we start? I guess I'll ask the first question. I don't know. Did you want to make any welcome comments, Andrea?
I just want to say if anyone has questions during the presentation, feel free to add them to the Q&A box. We will have time at the end to answer questions. We'll also allow anyone to come off mute if you want to ask your question live to us as well. And a copy of the recording and the slides will be shared after today's webinar. All right.
All right. Well, then let's jump right into it. Why don't we start by saying, what are we talking about here with regards to primary care, the opportunity, what's going on? And I'll let you go ahead and take it away with that as your first question.
Yeah, absolutely. So we are very excited that the AHEAD Primary Care Programs has an open enrollment period starting now, running through May 22nd. During that open enrollment period, there are three programs that practices can apply for. Two fall under the Medicare path and one under the Medicaid path. We'll get into more detail about the specifics of each of these, but we're looking forward to the opportunity for practices to join these value-based care models.
Well, and I did want to point out there's a big cross through that equip primary care that was not continued. But I will say that if that's something you're interested in, which is new infrastructure, there is coming out today from the Maryland Healthcare Commission a new program that is similar to that under the Rural Health Grant. So if that's something you're interested in, you should reach out to MedChi separately on that one too. But why don't we focus on primary care ahead, the Maryland Primary Care Program and the Medicaid Advanced Primary Care Program. And why don't we go ahead and ask the next question, which is who should complete these applications?
Absolutely. So we are focusing on primary care practices, obviously those that are interested in the program. So there are a few different ways that practices can apply, but the main thing is that practices should be applying into the Medicaid Advanced Primary Care Program first. If you are already in the Medicaid Advanced Primary Care Program, you can apply for one of those two Medicare programs, and vice versa. So really, we are just looking for anyone primary care focused that takes Medicaid patients and Medicare patients, looking to get more involved in these programs in 2027.
And it's really important that they do this now and not wait because today is May 4th that we're doing this webinar and the deadline for the applications is May 22nd. Is that right, Andrea?
That is correct.
Okay,
Yep, at 5 p.m.
so we'll probably mention that date several times just to get it burned into your head, but there really is not a lot of time to get all your ducks in a row. So again, if this is something you're interested in or thinking about, you should definitely try to set up a one-on-one meeting. We're happy to help. And I believe there's another webinar tomorrow as well, if you're interested, that the PMO is putting on, which is the primary care organization for the state of Maryland. So why don't we talk about what the eligibility requirements are for the different programs?
Absolutely. So this is a big one. For 2027 participation, all practices that want to join MDPCP-AHEAD or PC-AHEAD have to first apply to the Medicaid Advanced Primary Care Program. So we are referring to this as your gateway path. So you do need to meet the eligibility requirements for the Medicaid path first, And then you'll have the opportunity to select and fill out the application components for MDPCP ahead and PC ahead. With the Medicaid Advanced Primary Care Program, we are looking for a minimum of 250 assigned health choice members. However, this can be across all MCOs. So it doesn't just need to be one MCO that you're contracted with. Just in total, we're looking for 250 assigned members. You do have to have an EHR. You need to be able to report eCQM, so your quality measures. And then whether you are already working with CRISP or you are willing to get connected with them, you will need to, by 2027, have CRISP connectivity. So if everything looks good on the Medicaid side, then you can look towards the Medicare path options. For MDPCP ahead, this one does have an eligibility requirement of a minimum of 125 Medicare beneficiaries. We are also going to help practices understand the care transformation requirements that will be part of the application. We'll talk about that in a little bit as well. For PC Ahead, this is a great opportunity for practices that want to get into the Medicaid path, want to get into Medicare, but don't yet have that attribution. So the great news about PC Ahead is that there are no attribution requirements. So if you fall under that 125, this is a great opportunity for you to get into the program just at a slightly lower attribution rate.
All right, now we can talk about this maybe a little more later on, but MDPCP pays significantly more than PC ahead, correct? And
That is
and
correct.
right, and so really the goal, if you can do it, is to get into MDPCP because it is significantly more money. So what for example, and I didn't even tell you I was going to ask you this, so I hope you know the answer. What is the average practice in the MedChi CTO making additional payments for MDPCP?
Yeah, for
Roughly.
MDPCP, yeah, we have our practices making around 100,000 a year from participating just in the program.
And now that's an average, and obviously some of you are probably small one or two practitioners, others are five or six, but that's not they're mostly small practices in the CTO. So that should give you a rough idea. Where PC ahead, the payments are significantly lower. So if you can get into MDPCP, that's the way to go. And remember, we have not had open enrollment for MDPCP for 2 years now. So we don't know when it'll happen again. This really is the opportunity. So ideally, you apply for both the Medicaid and the MDPCP, and you get in both, and you're moving forward. Worst case scenario, if you don't have the attribution for MDPCP, you can do Medicaid and PC ahead, or you can just do PC ahead and not do Medicaid too. Correct, Andrea?
So you do still have to participate in Medicaid, regardless of the Medicare programs. So Medicaid is required for
For both?
2027
Okay. So
for both. Yep,
even to do PC ahead?
even for PC ahead.
Okay. I didn't realize that. That's good to know. All right. So let's talk a little bit more about the application process and when and how you could learn more about the application process.
Yeah, absolutely. So I know you already mentioned that there is going to be another webinar tomorrow, and that is true. There is what the Office of Advanced Primary Care is referring to as an open office hour. So if you have specific questions about your eligibility, about the application, about the programs themselves, the Office of Advanced Primary Care will be hosting a 1 hour office hour tomorrow, May 5th from 12 to 1. The registration link is in the slides that will be sent out. I'll also include it in the follow-up email. But this is a great opportunity for practices to ask questions with that office. If you can't attend that webinar, though, our CTO is here to answer those same questions. So we'll make sure we leave our email at the end of this, but it is cto@medchi.org. You can ask us the same thing, eligibility requirements, questions about the application, just to learn more about the programs. We can help fill that in as well. But one resource I really want to emphasize, and I think that this is a great first step for all practices, is to watch the recorded walkthrough of the application. If you've not already taken a look at the application, the walkthrough is a great way to see what questions and information will be needed. There is a demo being done where they go through with test information, but they'll walk you through all three applications. So in this application link, you are actually filling out your Medicaid application, and then you have the option to join and ask questions about MDPCP-AHEAD and PC-AHEAD. So it's great. They go through it in detail. You can see again what's going to be required, and then kind of gather that information. Another piece of advice that I would give to practices is if you want to start the application, you do have the option to save your progress along the way. So, as Jean said, it is a pretty tight timeline that we're under right now. So, everything is due by May 22nd. So, if you kind of want to space things out, start adding in information that you have now, you can do so. And we'll be sure that the application link gets out to everybody so you can get started with that.
All right. And I guess the other big question is what's the deadline, which I already gave it, but we're going to try to drive that home because I think that's a really important issue.
Yes. Absolutely. So if you aren't looking at the screen, kind of tune back in for us. The deadline to apply to all three of these programs is May 22nd by 5 p.m. So that is a Friday. It's right before the holiday weekend. So we know if you're taking time off to kind of extend that 3-day weekend already, we want to get these applications in as soon as possible for you. As I mentioned, our team is more than happy to help you. We will do one-on-one meetings with you and your staff to go through the application, ensure that you're filling it out correctly based on the questions being asked. And we'd be happy to set up those meetings as early as later today if you'd like. So our contact information is on the screen as well. And as I mentioned, you can email that. It does contact our entire CTO team, and someone will be in touch with you to schedule that one-on-one kind of walkthrough.
Before we open it up for questions, I'd just like you to answer this question. You're on the call. What should you do? What should you do right now if you're thinking, you know what, we really need to look at this. This is worth us doing. We would like to be in one of these
I'm losing a little bit of your audio there, Jean.
No, I just said what my question is, what's if you're on the call and you're going, okay, I'm really interested, what do I do next? What's the next step for the people who are thinking, I want to be in one of these programs, I want to be in one of these. What is the next step for them?
Yeah, so I don't know if it was just on my end, but I think what Jean was saying is next steps. So what to do if you're interested in these programs, what should you be focusing on next? And the first thing is going to be reviewing program eligibility requirements. So you can take a look back at that slide in this presentation when you receive it, see if you meet those attribution requirements. Again, if you have questions about them, let us know and we can go through a little bit more in depth about what those requirements look like. And then I emphasize again, watching the recorded walkthrough of the application. Get prepared for these questions. So when you go in to answer them, it's not the first time that you're seeing them. You're not so surprised. And then the last thing that I highly recommend, and you've heard us kind of drive this point, is connect with us, connect with MedChi, connect with our CTO team, and let us assist you with meeting that May 22nd deadline.
All right, so I think we're going to open it up for questions from the group now. Are you able to hear me now this time, Andrew?
It's still sounding a little far away on my end.
Yeah, it might be. I don't know. Maybe I'll even talk louder. But we'll go ahead and answer any questions anybody has. But I did want to point out that some of the things that we can help you with are issues that have tripped up practices in the past. Things like connectivity, PICOS, things like that that have been an impediment to participating in these programs. And that's something that it's easier for us to help you if you call us this week than it is on the 22nd at 4:30. So we just would really ask that you reach out and talk to us so we can help you get in this. The other thing I wanted to point out to everybody who is involved with the Maryland Primary Care Program is MDPCP is no longer a federal advanced payment model. And this is really important And as a result of that, we are strongly encouraging and we develop some equip bundles for primary care for folks to consider equip. We will do a separate webinar on that because equip sign up is not going to be till later in the summer. But that's something else that we would suggest that people consider doing as well. So, all right, anybody want to raise their hand or anybody want to be the first one to ask the first question?
And I do see that there's a question in here about entering in the URL for tomorrow's webinar. So I'm going to go ahead and paste a couple links for you guys to have access to.
All right.
All right. And if anyone wants to raise a hand, come off mute, feel free. We are happy to answer questions live as well.
All right. If there are no other questions, um, then we can give it another couple seconds and then we can go ahead. Is there anything else closing, Andrea, that we should consider or think about?
Just don't wait too long to get started. We just want to make sure everyone has the opportunity to apply that is interested. As Jean mentioned, we've not had open enrollment for a few years. So if you know of any practices that you think maybe aren't on today's webinar but would be interested, we would be happy to talk to them as well. Oh, and it looks like we did just get a question come in about the Medicare 120 patients per year. Is that attribution per year or is it over a longer period of time? So the easiest way that I can answer this is that CMS does set up an algorithm for their attribution. So it is looking back for a longer period of time than just 1 year. A great way for practices to kind of check in on their Medicare patient count is to look back in your like billing and claims data and see how many Medicare patients you have in total. We are looking at straight Medicare, not Medicare Advantage. Looking through that, you should get a decent idea of your attribution that CMS would also be viewing.
And then we have another question. Can you clarify the information on the MDPCP and federal funding? So the Maryland Primary Care Program is funded through January 1 of 28. So there is funding and you are signing up for the 27 year. There is a study that is planned in the AHEAD agreement, and then there'll be a decision that will be made on what happens after January 1 of 28. So that is a legitimate point, Catherine, to bring up. But obviously, getting in, people are having trouble hearing me. So if you could repeat that, Andrea.
Is there anything potentially over your microphone, Jean?
I don't think so. I think it must be a malfunction of some kind.
Okay.
Just go ahead and say what I just said so everybody can hear it clearly.
Okay. So I'm going to actually have you repeat that for me, Jean. I think you had said
No, I
that
was
there
just
is
saying that it's,
yeah.
can you hear me okay now if I speak loudly like this, or are you
I'll repeat what you say from there. Go ahead.
All right. So essentially the program is funded through January 1 of 28. MDPCP is federally funded through January 1 of 28. Then there's going to be a study and a determination by the federal government as to whether or not it will be continued with regards to MDPCP.
Okay. Was anyone able to hear? Oh, it looks like. Did his audio pick up? So we are funded through 2028. Hopefully you guys can hear me okay. Still no audio. Okay. Gina, it looks like you can type in an answer if you want to type in as well, if that didn't answer their question.
Well, the problem is if I type it, does it go to everybody? It's all
It
right.
should, yes.
can ask if there are any other questions.
Are there any other questions? All right, I'm not seeing any come through, and I haven't seen any requests to come off mute yet. Okay, we'll let Gene get his response in, and then if there are no more questions, we'll be able to wrap up and give you guys some time back in your afternoon. All right. Well, I'm not seeing anything else come up, but as you can see on the screen again, I'm going to leave our, oh, just kidding. There's one more. Is there a way to look at Medicare allocation through the CMS system? So I think this is Legia. If you want to leave your email, I'd be happy to talk more about the specifics of Medicare attribution with you. We can follow up and set up a time to meet there, or at least do some emails. All right. And then, as I was mentioning, our CTO email is on the screen. Please feel free to reach out, and then please add to your calendar that May 22nd, 5 p.m. deadline, so that you don't miss the opportunity to apply.
All right. Well, thank you, everybody. And I apologize for my audio problems.
All right. Well, of course, at the end, it sounds like it came back, Gene. All right. Well, we'll go ahead and end the webinar. I hope everyone has a great